Hi class, my name is Mackenzie Palafox and I'll be talking to you about human immunodeficiency virus and acquired immunodeficiency syndrome, mainly focusing on the 1980s when it came to the United States. My first slide addresses how has this disease been understood, what have people thought caused this disease, how did they come to that conclusion, and how has that changed or not changed over time. In 1981, around the time when AIDS was first discovered in America, the main groups associated with getting AIDS was homosexuals, drug abusers, hemophiliacs, and sexually active heterosexuals. People thought that homosexuals were one of the most common AIDS victims because their sexual preference was unnatural. It has been found that it actually spreads more in the gay community because it spreads more through unprotected anal sex than traditional heterosexual intercourse. The reason for this is because most gay males practice both the top and bottom positions, which heterosexual couples do not have the ability to do, but they can still catch it more commonly from the male transferring it to the female. In 1983, HIV was found by scientists, and in 1984, they confirmed that definitively that HIV was connected to people getting AIDS or having more of a high risk of getting AIDS if HIV had gone untreated for a certain amount of time, making them more high risk. The strongest evidence that HIV causes AIDS comes from the prospective epidemiological studies that document the absolute requirement for HIV infection for the development of AIDS. It has been shown for every population group studied in the United States and elsewhere that in the years following the introduction of HIV and subsequent seroconversion of members of that population, the features characteristics of progressive immunodeficiency emerge in the predictable sequence resulting in clinical AIDS. It is now known that AIDS can spread through sexual transmission, blood, and or having HIV. My next slide addresses, has there been any change in the way that the disease has been defined? Have different symptoms been attributed to this disease? Today, HIV, acquired immune deficiency syndrome, is a disease of far greater demographic diversity affecting all ages, sexes, race, and income levels. In 1980s, HIV hit its highest record of 130,000 people affected in a year, and since then it reached another peak in the late 90s and has since stabilized in the new cases diagnosed each year. Scientists have found that highly active antiretroviral therapy can help lower the amount of HIV transmissions. The symptoms of HIV may not come right away, and some may have no symptoms for up to 10 years while still spreading the disease. But some symptoms include flu-like symptoms such as fever and aching, which can last up to 2 weeks and then go away. Without treatment for HIV, you can then develop AIDS and have symptoms such as thrush, yeast infections, constant infections, headaches, losing weight, bruising easily, coughing spells, etc. How has this disease been treated by the medical community and what treatments have doctors prescribed? And has this changed in any way over time? What we need to know is that by 1986 and 1985, countries had reported 38,401 cases of AIDS to the World Health Organization. These numbers are only the reported countries such as Africa, the Americas, Asia, Europe, and Oceania, and has increasing numbers. How the medical community responded was first to bring awareness and then to discover treatment for the first stage of progressive disease, HIV. By 1987, FDA approved the first antiretroviral drug, zidovudine, as treatment for HIV. HIV, human immunodeficiency virus, is the first stage to acquiring AIDS. The breakdown of the immune system without medication can lead to swift ending of AIDS. So the medical community first developed a way to attack HIV with an antiviral medication. This medication can control the virus, which would in turn give people a long and healthy life. There is an HIV regimen that people who tested positive should take every day, and with this, they can live a productive life. AIDS itself cannot be cured, but rather it is the last stage, stage 3 of the virus HIV. How has this disease been understood or viewed within the society, and has it changed over time? In the 1980s, little was known about this disease breaking out among Americans. Homosexuals seemed to be the only ones affected, and fear was the reaction from the general public. No one knew enough about the disease except that if you contracted it, you died. How you contracted it was not yet available, so people were dissociating with friends, family members, or coworkers that were part of the gay community. Because of the ignorance of the disease and that you had to have HIV positive in order to contract AIDS, people, or better yet, society in a whole, were running scared. The president at the time, President Ronald Reagan, had little or no knowledge of what was killing the young men who at the time numbered 600 deaths. People were afraid to touch or get near anyone who could possibly have AIDS, that being a gay person. Society did not handle the disease of AIDS very well in the 80s. Because of the lack of knowledge, perception was if you're gay, you must have AIDS. Now, 39 years later, the saying, knowledge is power, is so true. What we didn't know back in the 1980s, we are far in advance now. People are no longer scared of the neighbors next door who are known or a known gay couple. We know that the AIDS is not spread by a hug or a handshake, that there are ways to prevent it even in the gay community, and HIV does not need to be a death sentence with care and proper treatment. In this last slide are the citations of the sources that I used in order to create this presentation, and I'm all done. So if you have any questions, go ahead and feel free to comment them, and I'll try and respond to all of you. Thank you.